Hi everyone, my name is Ananya Bhattacharjee and I'm going to talk about our paper Investigating the Role of Context in the Delivery of Text Messages for Supporting Psychological Wellbeing. This work has been jointly done by researchers from University of Toronto and Northwestern University. Without a nuanced understanding of users' contexts like mood, energy, or time, text messaging tools for supporting psychological well-being risk delivering interventions that are mismatched to users' dynamic needs. As a result, messages risk being perceived as insensitive to the user's current mental state or availability. Incorporating information about a user's context has the potential to overcome this fundamental challenge of disengagement with push-based tools. Just-in-time adaptive interventions, or ZTIs, incorporate factors like time of the day, location, and step counts in their algorithm to deliver contextualized support. Now, ZTIs have shown promise, but they're still far from accounting for dynamic changes in people's lives. It should be noted that mental health context involves complex relationships between social interaction, movement, and mental state. Digital mental health tools are historically designed in a top-down process without understanding users' perspectives and preferences. Users are rarely asked for input on how contexts shape their need for support and decision rules for interventions. Literature suggests that to implement contextually tailored systems, designers should carry out formative investigations with actual users to understand their needs and expectations. Motivated by this, we started with a formative study consisting of interviews and focus group sessions with 36 participants. Then we designed two message dialogues based on participant feedback. We deployed a text messaging probe to 42 participants and we ended with follow-up interviews with 20 of them. Our investigation was motivated by two research questions. First, which contextual factors are perceived to influence the user experience of a text messaging service for psychological well-being? And second, what specific elements of text messaging interventions need to be tailored to reflect the user's dynamic contexts? We focused our investigation on the young adults between 18 to 25 years old. We relied on two sources of participants. Firstly, young adults who demonstrated elevated symptoms of depression and or anxiety. These participants were facilitated by Mental Health America, a non-profit organization. Secondly, we also recruited students from University of Toronto. For the formative study, we recruited 36 participants, and for the deployment, we recruited 42 with representations from multiple genders and racial groups. From the formative study, we found that daily schedule plays an important role in shaping message receptivity and preferences. Morning messages were considered inspiring and motivating for the day ahead, and afternoon messages were seen as helpful for those experiencing loneliness and negative thoughts after work. However, some were concerned about receiving messages in the morning due to time constraints and rushing for work or school. Participants were also not interested in receiving messages during the middle of the day or during intense working hours. In our deployment study, we designed a daily schedule dialogue where participants were sent two sequences of messages each day. One message came at 9:30 a.m. in the morning and the other came at 4:30 p.m. in the afternoon. Each sequence started with one or two messages designed to help people manage their stress or negative emotions randomly selected from a message bank. 1 hour after the initial messages, participants were asked whether they enjoyed reading the messages and received an acknowledgement message based on their feedback. Going back to our forward study findings, we observed that one's mood and energy level or affective states play an important role in shaping message receptivity and preferences. Many suggested simple check-in messages and coping strategies during low moods, but advised against anything that demanded high effort responses like writing. Messages that required typing were seen as appropriate during positive emotions. Participants in the deployment study were sent messages based on their emotions in the valence arousal dimension. People with low mood received a short, supportive message to manage negative emotions, which we refer to as passive support reception. People with high mood, on the other hand, participated in an active writing activity to draft supportive text for others. In our affective state dialogue, we asked participants about their current energy, mood, and actual emotions, and based on their responses, we either request them to read a supportive text from others or we ask them to participate in an active writing activity. Now, when we deployed our daily schedule dialogue to deployment study participants, we saw that they were again divided in their choice between the morning and the afternoon. However, some participants acknowledged the importance of messages during work hours. Reminders to take breaks were perceived as helpful during intense work hours. This meant that messages should be strategically distributed throughout the day to provide sustained benefits and to maximize the likelihood of follow through. One way to do that could be sending background information in the morning and suggesting the actual activity in the evening. Regarding the affective state dialogue, many people found emotion labeling to be helpful, noting that the activity facilitated emotional awareness. It also gave them a sense of control over the type of content they received. However, people had contradictory opinions regarding the number of questions at the beginning. It was overwhelming for some who were not motivated to write or type, but some others opted for more questions to elaborate their emotions. People suggested for features that could enable them to select multiple or more nuanced emotions. Daily schedule and affective states were found to be connected, with mood and energy levels fluctuating throughout the day. Anxiety in the evening and undue stress when anticipating a busy schedule were reported by some participants. They also required less support when they were surrounded by others and did not want to be reminded of strategies for managing negative emotions in social settings. Our work enabled us to answer both of our research questions. We found that daily schedule and affective states were important contextual factors that influence the user experience of a text messaging service for psychological well-being. We also identified three specific elements that need to be tailored to reflect the user's dynamic context, and their message volume, required effort to engage, and time sensitivity. Based on our findings, we also make design recommendations. We suggest that ways of collecting daily schedule, sleep, and physical activity information should be incorporated. This can be done through mobile phone sensors, integration of digital calendars, or enabling the feature of on-demand messaging that allows users to request for messages when they are stressed or anxious. However, we realize that in enabling these features, privacy and security measures should be taken. We also suggest that mood and energy leveling questions should be personalized. One way to do that could be starting with an open-ended question to identify users' motivation to respond, and based on their motivation level, the number of questions can adapt. In conclusion, we investigated contextual factors that influence user experience of text messaging services. Formative work with interviews and focus groups revealed daily schedule and affective states as prominent contextual factors. Deployment study confirmed the importance of adjusting timing and identified specific elements that should adapt. And we hope that our work represents the first step towards the development of user-centered, context-aware digital mental health tools. That is all of our work. Thanks for your attention.